Hi, my name is Hugo Gonzales. I am a clinical psychologist at COPE Centre. Today we are going to talk about acculturation of migrants. So migration occurs across the globe due to a range of factors such as social conflict, unemployment, and poverty. Migration is associated with culture shock and increased prevalence of depression, anxiety, and schizophrenia among some minority ethnic or migrant populations. Some research has found that migration was also associated with increased engagement with risk behaviors such as smoking, drinking, and sexual activity, particularly in second-generation migrants. The process that migrants go through in adjusting to a new culture was defined and described by Berry in 1990, and the term that he used is acculturation. Two independent dimensions are considered to underline the process of acculturation. Migrant linked to the heritage culture and his or her link to the receiving culture. According to this bidimensional approach, for acculturation, patterns are possible. Assimilation, whereby limited interest and involvement is made to maintain the heritage culture alongside a high level of involvement with the receiving culture. Separation, in which there is high involvement in maintaining the heritage culture and low involvement with the receiving culture. Marginalization, in which there is low involvement in both cultures, and integration or biculturalism, in which there is high involvement in both heritage and receiving cultures. Biculturalism, in which the individual integrates the heritage culture and the receiving culture, is the most adaptive approach to acculturation and is associated with improved mental health outcomes compared with other acculturation patterns. Acculturation has been broadened to include practices such as, for example, language use, food, music, friends. Some values such as individualism or collectivism, and identification, feeling attachment, and solidarity across both heritage and receiving culture. However, there are other factors including racism and discrimination, lack of cultural knowledge and language fluency, or in overseas qualifications not being recognized. For example, discrimination is associated with poorer health in migrant and ethnic minority groups. Discrimination has been linked to social mobility. Many migrants experience a status loss due to discrimination. So, how can we achieve better adjustment in migrants? Or how can we improve the acculturation of migrants in the receiving society? First, keep a strong ethnic identity that will contribute to higher self-esteem, pro-social tendencies, peer acceptance, popularity, academic motivation. Second, your strong ethnic identity in migrants may be a protective factor against depressive symptoms and drug use among ethnic minority individuals. Third, a strong connection with your ethnic community will also ensure a safe access to support network in the receiving culture. Biculturalism is an asset. Retention of your native language contributes to better adjustment. be alert to experiences of discrimination, racism, and microaggression. Remember that Australia is a multicultural society and cultural diversity is valued and critical in our identity as a nation. Thank you.